Today we're here to talk about pressure ulcers, or what's known in medicine is called decubitus ulcers. You may have also heard the old term called bed sores. Now these can occur two major places in the human body, but the one that we're concerned about today is on the heel. What happens is in a pressure ulcer is it's usually from somebody who lies in one position constantly. Or maybe they're sitting in a wheelchair or some other device where their foot is getting pressure because it's laying against a plate or some other type of support. What can happen is over time is because of that constant pressure, there's less oxygen to the tissue. The skin then starts to die off, which then causes the skin to turn black. Initially, you may see a red spot that almost looks like it's some type of inflammation. But over time, and sometimes very quickly, it can actually turn black. Now what happens is it's usually located on the bottom of the heel and the back of the heel in the humans. And after time, this will start to get pressure on it. Now we see this both in diabetics, but also mostly in people with very poor circulation. Once the cells start to die off and they've turned black, that is just part of the problem. That's the tip of the iceberg. Underneath that is going deterioration and eating of further tissue. That then allows kind of a gooey type of, almost like an auger type thing where bacteria can grow. The bacteria will then get into the tissue and can actually penetrate deep. Now in our heels, as we age, unfortunately, we lose the protective fat pad on the bottom of the heel. And then on the back of the heel, there usually is not much fat there anyway. So you basically have skin, a thin layer of fat, and then you're right to bone. And the heel bone, or calcaneus, is a very porous bone. It's made of what we call cancellous bone versus cortical bone. Cortical bone is very hard. Cancellous bone is very porous. Think of kind of like a sponge that has a lot of holes in it, a lot of channels. And what happens is if bacteria gets in there, it spreads rapidly throughout the heel bone. Sometimes we can treat that with antibiotics, but if a person has poor circulation, the antibiotics might not get there. Sometimes we have to do surgical debridement and pack the area with beads implanted with antibiotics. However, once it gets into the bone, it can be a big disaster. Many times there's no good way to get rid of it, so the person can actually end up losing their whole foot, or many times even up to the knee because of the necessity of getting them into a prosthesis. So these can be quite devastating to our patients. So what we want to do is we want to kind of prevent these from occurring. And how can we do that? There's several ways. You can buy these big expensive pads that kind of cradle the foot. You can put some type of protection around it. One of the most common is kind of something made out of fleece or sponge. The problem with some of those is it still allows, even though it cups the heel, it still allows some pressure from the bed to come up directly, or the foot plate, and come up directly and press on the heel. It's reduced the pressure, but it hasn't eliminated. The more sophisticated ones actually will allow for pressure off of the heel in total. Now sometimes those ramps can be expensive. So a good way at home is to take a blanket or to take a towel. And what you want to do is you want to place it behind the ankle so that it suspends the heel. You don't want it on the heel, you want it back so that we see a space in here. And you want somebody to sleep that way, or anytime they're laying in bed, you want the pressure off of there. The bigger and the higher the elevation, the less likely you are to have some type of pressure on there at all. So we want to eliminate the pressure. Sometimes in severe cases, if we have a big blanket, we'll actually put it long ways, again, to keep it up. Many times we discuss this with the patient depending on how bad it is. So the big thing with pressure ulcers is prevention. Once they start, many times, but not always, they can be quite crippling. And that is something neither the patient nor the doctor want to encounter.